Occupational health is a big value. The service is really supportive.
They are independent. It's not just to get people back to work, it's looking out for the health and well-being of the individual.
If it hadn't been for the physio, I don't think I would have been able to carry on with my role.
It's really important that our staff are healthy and happy at work.
We want healthy staff, happy staff at work, and we want them to feel valued.
We deliberately set up the Occupational Health Department to actually support staff within a mental health, learning disability and community environment. And the department is out there to support managers and staff to help them with their health, well-being and ensure that they are resilient to face the challenges that any part of the NHS is going to face for the future.
We're all human. We all from time to time become ill or maybe have difficulties coping with some aspects of the job role, and occupational health are actually there to support staff when they are facing those challenges. Then again, occupational health can actually be used to support managers also. So they have a very clear but also very proactive role in the organisation in terms of maintaining health and well-being of the wider workforce, but also supporting individual managers with particular health and well-being challenges.
Both organisations total over 7,000 staff. South West Yorkshire has 4,500. We deal with some of the most challenging and vulnerable people in society, and whilst that brings a lot of reward, it also means it can be very stressful, and a lot of research has been done about how mental health and learning disability organisations tend to have a higher sickness rate than other acute services. I think a lot of that reflects around the nature of the work they're doing and the types of services that we provide.
We offer a range of services. We do workplace vaccination programme covering a range of workplace infections. We also offer follow-up following any contamination injuries such as a needle stick injury or a bite injury, and we also provide the seasonal flu vaccine. We also provide work health assessments, and those assessments are for people that are in employment that may be struggling at work or absent from work. At times in our lives, we all come against things that causes anxiety and stress. To support that, we have a counselling service within South West Yorkshire. In Leeds Trust, we offer an employee assistance programme, or EAP for short, and that is accessed by telephone counselling or face-to-face counselling can be arranged. Both trusts provide a fast-track physiotherapy service. The aim of this is so staff can contact them and get an appointment within 5 working days. Staff can access the physiotherapy service for any musculoskeletal issue, so whether that's work-related or whether you've sustained that injury at home. We also provide wellbeing checks, and this might be in the form of blood pressure checks, BMI checks, cholesterol, blood sugar, all aiming to promote health and well-being amongst our staff and prevent illnesses occurring. We aim to take a proactive approach to our employees' health and well-being, and we've developed a stress management pathway for managers and staff to access. It means that everything to do with stress and how you manage with stress and how you move on from that and develop the tools to manage your stresses are all in one place. It's available on the intranet, and it will talk people through how to manage the stress. We've tried to make our service as accessible as possible given the wide geographical area that we cover. We do run a range of satellite clinics throughout both trusts to make it easy for staff to access a clinic near them. Employees can email us, then they can contact us by telephone.
We recognise that staff can feel quite vulnerable coming into departments like this, and we need to find ways whether we can give them confidence. And staff that have been involved has been very important in the success of the organisation.
There is a misconception that the only role of occupational health is just to get people back to work, no matter what. I've been around for quite some time now, and I know that if you take a step back, that's not true. They are independent, they're filling a role. It's not just to get people back to work, it's looking out for the health and well-being of the individual.
Leeds and York Partnership Trust and ourselves have the 2 lowest sickness rates within the region for comparable organisations, and I think it's no coincidence that we have a partnership arrangements with an occupational health service.
I found the occupational health team really helpful, very supportive, and all the staff were really friendly.
The service is really supportive. If it hadn't been for the physio, I don't think I would have been able to carry on with my role. I'm able to walk about 1.5 miles that I never could do before.
This occupational health department has been recognised nationally as leading edge and actually has been put forward in a number of areas as good practice. And I think it's fair to say, whilst that's important, the most important thing is really it's been accepted within the organisation and staff are really confident about it.